Hi guys, my name is Dr.Mazhar and today I just start a series of lecture on hematology. In hematology, I just start discuss about anemia. So what is anemia? First of all, I will describe its definition and its signs, symptoms, causes and their management. As you can see in the picture that normal amount of red blood cells and the blood which anemic. So normal blood cell contain a lot of RBCs, but in the anemic there are left less blood cells. Okay, now talk about the anemia. What is anemia? So anemia simply defined as decreased HP hemoglobin concentration inside RBC. So it is a definition of anemia. Then we classify anemia. On the classification, there is a microcytic anemia and then there is a macrocytic anemia. In this lecture, I will just talk about the microcytic anemia. So what is a microcytic anemia? Microcytic anemia mean micro means small and cytic means cell. So cell size becomes small, which cell size RBC. So what are the causes of microcytic anemia? So these are the few causes. The first cause would be iron deficiency. So iron deficiency itself have many causes. So what's the causes of iron deficiency anemia? It can be due to abnormal menstrual cycle, GIT bleed, duodenal ulcer, chronic intake of NSAID uses, and hemorrhoids, decrease oral intake, gynecological losses like fibroids, and chronic inflammation. That chronic inflammation lead to the increased hepcidin. That hepcidin will eventually lead to decreased iron absorption from enterocyte into the blood. So this is the causes of iron deficiency anemia inside the microcytic. Then what are the other causes of microcytic anemia? Thalassemia, in which there is a RBC size becomes small, there is a decreased beta chain formation, and anemia of chronic disease like hepcidin play a role in this thing because chronic disease like rheumatoid arthritis or osteoarthritis can increase hepcidin. So hepcidin decrease the iron absorption from enterocyte into blood and lead poisoning. Then there is a iron deficiency anemia sign and symptom. As you can see in the picture that the nails showing some koilonychia like spoon-shaped nail in iron deficiency, and then there is an inflammation of the lips we call angular stomatitis, inflammation of some border of lips or the mucous membrane, and then there is a lower conjunctiva. This looks paler. So this is a typical signs of iron deficiency anemia. And then there is a we call the Plummer-Wilson syndrome that lead to iron deficiency anemia, include microcytic anemia, esophageal webs that lead to dysphagia, and glossitis, that inflammation of your gum, inflammation of your lips around the borders of your lips. Then what's the clinical features of anemia? Here are some clinical features. As you can see, shortness of breath on exertion, fatigue, decrease oral intake, pallor, and changing nail structure. So these are the some clinical features that patient present to you when patient have anemia, either a deficient. If any type of anemia, these symptoms are common. Doesn't matter it will be microcytic, macro, or normochromic. So typical sign feature will be same. Patient present these symptoms. And what are the investigations we will do in anemic patient? First of all, we do CBC for checking micro or macro, serum ferritin for checking what's the iron load in the body, LFTs to checking the liver function because sometimes liver produce so much hepcidin. So we will check LFTs. Then blood morphology for checking any abnormal cell size or its morphology, and we do ultrasonograph of abdomen pelvis to see any splenomegaly, hepatomegaly, because sickle cell anemia lead to what hepatomegaly and splenomegaly as well. Then what's the management? The management of iron deficiency anemia depend on treat underlying cause. What's the cause? If decrease iron intake, counsel the patient to take iron-rich food as well as provide them iron supplement for at least 3 months. And if renal failure, then provide them erythropoiesis. So this is a just short overview of microcytic anemia. What are the causes? What are the signs, symptoms, and management? So in my next lecture in hematology, I will describe about the macrocytic anemia. So I hope you understand. Thank you very much.